just wake you up because you had it.
Yeah, yeah. Relatively rare, but you know.
So when you know, like have a flu, a cold, so you have a headache, so that is an inflammation.
Yeah, I guess, yeah, could be. I mean, like I said, there's literally hundreds of different causes, and everyone's a little different. So.
So it's the nerves, because
Yeah.
you said the brain.
It's the
not-
nerves covering the brain that can cause it, that cause the pain. And also the nerves in the face and the nerves on the scalp. But deep in the brain, there's no pain receptors.
Yeah, Dr. Money, could you maybe say a few words, I don't know, it's a big topic, but about rebound?
Oh yeah, great question, great question. Yeah, so I see this all the time actually in the clinic. Somebody has a headache, they take a non-steroidal, sometimes an opioid like Percocet, oxycodone, powerful drugs, it alleviates the headaches, but then the headache comes back worse than before, and then they take the medication again, and then it comes back worse than before, and it's a vicious cycle. That's actually the most common reasons why people end up in the hospital for migraine headaches, because they get this in this vicious cycle, and the biggest culprit is the opioid medication. So I never prescribe those powerful medications for headaches, and if they are on it, I always tell them to, you know, cut it down or not take any. But it's hard because they have this excruciating headache. It treats it temporarily, but it comes back worse than before.
It really feeds on itself.
Yeah, it's a vicious cycle.
Hmm.
Yeah, and it's very, very hard to treat. You just you pretty much have your hands tied behind your back.
You need a very motivated patient to put up with the process of getting these
Sure.
medications.
Yeah. But in the hospital, I start them on IV, you know, Decadron and steroids, things like that. But even that only puts a dent in.
If they're in the hospital, usually about how long do they stay in the hospital?
You see, yeah, that's interesting. That's an interesting question, because when I was a resident, we never ever admitted anybody with migraine headaches. But in the last 6 months that I've been at GBMC, probably about 5 or 6. So I think some of it has to do with the culture of that hospital. Because migraine headaches are not deadly. They're not going to kill anyone, so they would just discharge them.
Yeah.
But here they, you know, and I don't make the decisions on who gets admitted or not. Usually the ER does.
But it's a diagnosis, right?
What?
You know, if you don't diagnose it right, so
Diagnosis, yeah, sure. And that's why when they come to the hospital, they always get a CT scan.
Oh,
But that usually rules out the major causes, like a head bleed, which is one of the most deadly causes of a headache. So most of them are ruled out for secondary headaches.
okay.
Although an MRI takes longer, they eventually do get an MRI in the hospital, which keeps them here for a little bit longer.
Just have one other question.
Sure.
I've read a little bit about some doctors and scientists who believe that a lot of food products that contain various chemicals and additives and so forth
Yes.
are particularly troublesome in terms of causing headaches.
Sure.
Do you have a thought about that?
Sure. I mean, we know nitrites, which are found in processed meats, MSG products, and certain cheeses. Those we know definitely can cause and do cause headaches in a pretty substantial subpopulation. But you know, I'm sure the range is actually bigger than that, and there's probably many other chemicals that can cause headaches too.
Do you ever have patients that just basically eat fresh foods only and stay away from, at least for a period of time, stay away from all processed foods? Is that something you've ever?
Yeah, I had a patient today who came to my clinic with migraine headaches, and she was a vegan. So I doubt if any of her diet is causing the headaches. But you know, she could have a headache from, for example, skipping a meal. But I don't personally know of anyone who changed their diet or became a vegan or some sort of dramatic diet because of headaches.
And was successful with that.
Yeah,
Yeah.
but I haven't. But yeah. But what I do ask them to do is try to figure out the triggers and avoid those triggers. And a lot of people do figure out triggers, and some people don't. And one of the most common triggers is stress, and that's sometimes very difficult to avoid. Even when you know stress causes it, it's pretty hard to avoid. Yes,
I have a question.
sure.
From your perspective of prescription medication, like the Imitrex, it seems like whenever we give our patients certain prescriptions for migraine headaches, as Imitrex, it's always like prior auth or they limited quantities of them. Is there a reason that you can think of that they just zone in? Even for cluster headaches, you know, some insurance companies won't recognize the oxygen therapy.
Yeah, the oxygen I'm sure is hard. Imitrex, I haven't had any problems. I think it's generic now. But some of the more expensive ones like Maxalt, you really have to, you know, explain how other medications failed and how long they were on it and fill out all this paperwork. But Imitrex, I haven't had that problem.
What about the oxygen therapy? Have you had
Yeah.
problems with that?
I haven't actually tried it.
Oh.
Yeah. So. But yeah, I had one patient that I think had cluster headaches, but I just put her on a calcium channel blocker instead.
I think it was the one patient that we were working with. He had like, I think Blue Shield or commercial insurance of some kind, but then was switching over to Medicare very
Sure.
shortly thereafter. And Medicare, I think, was the insurance company that would not pay for the oxygen therapy. And I'm
Yeah.
just wondering if you would-
Yeah, the oxygen therapy, I'm sure would be difficult, even though there's plenty of literature to say that oxygen treats cluster headaches, but I guess, I don't know if that's in the textbook or in the protocol they prove it, because I'm sure they're looking for some sort of lung problem for them to get oxygen.
And they have very strict criteria, and basically everybody fits the same mold. I mean, you get the same form for each
Right.
patient who's on oxygen therapy, and you have to show the same numbers. And I think the system is just not geared to recognize sort of atypical usage
Yeah.
of oxygen. So
Yeah.
it's just one of the, I think the quirks of Medicare probably came out of the time, like so many things, that everybody was being given oxygen therapy. Anybody with shortness of breath was given oxygen therapy even though they didn't really need it. And so Medicare sort of closed that loophole. But in
Sure.
doing that, they made it so hard to get the therapy for other causes other than
Sure.
heart and lung disease that it's really a pain to try to convince them that yes, this is really a
Yeah.
genuine indication.
Yeah, sure, yeah.
How about acupuncture?
Sure, yeah, I think there's actually some literature, scientific studies that also prove that acupuncture can help.
Yeah, because it's very hard. Yeah, I went there a few times. I mean, they really release
Sure.
right away.
Yeah. Pain in general, I think acupuncture is effective based on the studies.
We use acupuncture also for nausea,
Oh, yeah, sure.
chemo.
Yeah, yeah, yeah. That's also, there's studies to prove that as well, yeah.
Any other questions?
Did you say you use Botox for Botox injections?
Yeah, yeah, for migraines. It was actually FDA approved about, I guess, a year and a half ago. And
Just sub-Q shots on the skull
Yeah.
or something?
31 different areas around the forehead, the side of the head, the back, and a little bit of the shoulders.
Sounds kind of crazy. Would that increase somebody's head size?
No,
Stretch on the skin.
That sure ought to do something for the tension.
yeah, 150 units. But yeah, each one is small now. And, you know, you would think that it's helpful in tension headaches because it's musculoskeletal,
Mm.
and not migraine headaches, which is more, involves the nerves, but they got it approved through the studies. The theory is that it decreases a substance called substance P in the brain, which is responsible for pain.
So we just really don't know, why causes the headache in a different part of the head.
Yeah, they think it releases less of a certain chemical that's responsible for pain. That's the theory, at least, behind it.
Yeah, it's a different part of the pain. It's not always, there's a whole part, sometimes the front, sometimes it's a whole, sometimes the back. So you have to research which part.
You're supposed to do it all around the head. At least that's the way it's recommended. I'm sure some people do it differently.
Is that substance measurable?
In the blood?
Anyway, yeah, in the blood, whatever.
You talk about substance P?
Well, yes.
Oh, substance P, yeah. It is somehow measurable, but it's not commercially available. It's, I guess, in the laboratory they have a way of measuring it. Yeah.
Any other questions? Dr. Bonnie, thank you very much for
Sure.
your enlightening talk. We appreciate it.
Thanks for having me. It's a pleasure.
That was excellent. Thanks so much.
Thanks for inviting me.
Sure. Oh, we had a drawing. We're going to do a drawing.